Today we'll be going over the American Academy of Pediatrics, also known as the AAP's newest policy statement on systems-based care of the injured child. There are 10 recommendations and 8 action and implementation strategies, so let's get started. Starting with the recommendations, the unique needs of injured children and their families should be integrated into trauma systems and disaster planning at the local, state, regional, and national levels. An integrated public health approach to pediatric injury should address the needs of children across the continuum of care, including injury prevention, pre-hospital care, emergency and acute hospital care, rehabilitation, and long-term follow-up to optimize successful reintegration into the community. Evaluation and management of the injured child begins with EMS clinicians in the field and clinicians in urgent care centers and emergency departments who have education, competency, and proficiency in pediatric readiness at the point of trauma care. Emergency departments throughout the United States should refer to pediatric readiness guidelines to facilitate appropriate care for all children. Specialized pediatric trauma centers are essential components of trauma systems and should provide support and guidance to non-pediatric and non-trauma centers as part of their outreach mission. All members of the healthcare team across the care continuum must be aware of potential abuse when evaluating injured children, including equitable reporting of concerns to the appropriate authorities. Optimal recovery after injury requires a trauma-informed approach, and the mental health needs of injured children and their families should be supported through screening and the provision of appropriate resources tailored to their needs after injury. National organizations with a special interest in pediatric trauma should work together to ensure pediatric trauma care is multidisciplinary and collaborative to provide the highest quality of care. Pediatric trauma care teams should actively work to provide equitable care to all injured children. Systematic and transparent data collection and data sharing must occur at local, regional, and national levels to inform all aspects of trauma care, from injury prevention to research and advocacy. Now moving on to action and implementation strategies. State and federal institutions should financially support pediatric trauma system development and maintenance, disaster planning, data collection, and sharing, research, and education. Every state or region should identify specialized trauma centers with the resources to care for injured children and establish systems to triage injured children appropriately based on their needs. Healthcare systems should actively participate in and cultivate injury prevention programming to reduce the rate of pediatric injuries. Pre-hospital and hospital clinicians should make every effort to stay current in the management of injured children, including the ability to evaluate, stabilize, and transfer acutely injured children. Direct feedback from trauma centers can assist with continued process improvement for pre-hospital teams and agencies. Interfacility transfer guidelines and protocols should be in place to facilitate rapid transport of critically injured children to trauma centers that can provide an appropriate level of care. EMS professionals and transport teams with pediatric expertise should be used in the interfacility transport of critically injured children. Evidence-based protocols for the management of the injured child should be developed for essential aspects of care across the continuum of care. These should be continually revised to reflect current evidence with the goal to improve outcomes after injury. Evidence-based mental health screening tools should be developed for use in the acute setting and in follow-up to aid in the early detection of children at risk for development of post-traumatic stress disorder. Those at risk should be provided resources and/or referral for early intervention by mental health professionals trained in trauma-informed care. Established performance improvement and quality improvement programs should be established at all centers caring for injured children. Closed-loop communication in the form of direct, constructive feedback should be provided by and to pediatric trauma centers to allow for continued education and improved pediatric care. And there you have it. Make sure to check out the full policy statement from the American Academy of Pediatrics and other related clinical decision support tools at guidelinecentral.com.